A 25-year-old man comes to his physician because of hearing loss in his right ear. 2 years ago, he had removal of a left-sided vestibular schwannoma. His mother had a history of progressive hearing loss. A vibrating tuning fork is placed on his mastoid bone, then by his ear canal, and he reports it takes longer for him to stop hearing the sound when the tuning fork is on his mastoid bone. Examination of the external ear and auditory canal is unremarkable. He is afebrile and reports no discomfort. Which of the following is most likely related to his current hearing loss? Choice A, mutation in an NF2 gene. Choice B, autoimmune demyelination of auditory nerve. Choice C, infection by an non-encapsulated gram-negative rod. Choice D, bony overgrowth of the stapedius. Or choice E, cerumen impaction. I'll wait 5 seconds and answer the question. Now, I was a bit of a jerk with this question because I know a lot of you who do not read this question properly will just instantly jump to choice A here. But if you'll notice, what I described here is that we performed a Rene test and found that the bony conduction was better than the air conduction, which means that this is a conductive hearing loss. So even though I wrote the question in a way to make you suspect that maybe he has neurofibromatosis type 2, you should probably still go look at the answer choices first and make sure there isn't a conductive hearing loss option here that is a better fit. I also told you in this question that there is a rather unremarkable physical examination and that he is afebrile, which means that he probably doesn't have an infection. So choice D, bony overgrowth of the stapedius, is the only answer choice that makes sense. This is talking about otosclerosis, where bony remodeling of the middle ear can eventually cause the footplate of the stapes to be fixated on the tympanic membrane, which causes a conductive hearing loss. So just go through the incorrect answer choices real quick. Choice A, mutation in NF2 gene. Like I said, if you'll pay attention to the Rene test done here, it revealed a conductive hearing loss and not a sensory neural hearing loss, so we should be less suspicious of a second acoustic neuroma in this patient. Choice B, autoimmune demyelination of auditory nerve. This is referring to multiple sclerosis. I mean, even if I wanted to go for a sensory neural hearing loss answer choice, this is obviously a much worse answer choice than even A. Nothing in this patient's history is suggestive of autoimmune disorder. And just generally, his presentation isn't similar to what an MS patient might look like, right? Usually an MS vignette will give you various different neurologic signs over a period of time. They tend to really like giving stuff like optic neuritis and intranuclear ophthalmoplegia. Sometimes they like giving urinary incontinence and just various motor and sensory deficits. Anyway, it's the wrong answer. Choice C, infection by a non-encapsulated gram-negative rod. This is referring to Haemophilus influenza, non-typable, which is a very common cause of otitis media. This would also cause a conductive hearing loss, but this patient, as I mentioned, was afebrile, and he's not in pain or anything. He doesn't have any discomfort, and like I said, the examination is unremarkable. You would usually see a bulging tympanic membrane or something like that. Finally, we have choice E, cerumen impaction. I mean, this one you can obviously eliminate just because auditory canal examination was unremarkable. So obviously if there was cerumen impaction going on here, you would see it. So bringing it back, just remember how the Weber and Rene tests work. I mean, in this case, we couldn't do the Weber test just because it wouldn't tell us anything since he already had hearing loss in 1 year. But remember how the Rene test is performed. It's there to tell if you have a sensory neural hearing loss or a conductive hearing loss and maybe no otosclerosis. It's kind of a diagnosis of exclusion. So it's more important that you understand things like acoustic schwannomas and otitis media. I hope this video was helpful. I'll see you in the next one.